Thank you, everybody, for the this session. Good morning, good afternoon, and good evening. Welcome to the 1430th day of continuous and uninterrupted Zoom session of IFPH. Let us have a silent prayer for a minute now. Thank you and welcome back. Today we have with us Dr. SUMANA KUMARI PANDA M.D. Homeopathy, retired District Medical Officer, Homeopathy, Cuttack Circle, Cuttack Health and Family Department, Government of Orissa, Consultant, Stabilizer, Homeo Clinic, Cuttack and Chowdar, Odisha. The topic is study of CALCARIA CARB through pediatric bronchial asthma in relation to abnormal calcium metabolism. I hope our guest is joined. Unfortunately, the time extended to 15 minutes. That's the problem created. And it's always better to keep the time, whatever may be the situation.
Yes, Dr. SUMANA KUMARI PANDA is there. Please, Doctor, please raise your hand. Madam, please raise your hand.
Yes, God. HP, yes. Is always to join with the real name so that you can identify. Yes. Okay.
Yes, sir, I am here.
Okay, yes, please.
Thank you, Dr. Manoj. Namaste.
So we have to conclude at 9 o'clock. Okay, 45 minutes. Yes, please.
Okay.
Yeah.
Okay, sir. So thank you, everyone, and welcome to all the participants to this session. And at the outset, I am very much thankful to the organizers, IFPH, and my teacher, Dr. M.K. Shani sir. Sir, namaste. So next, straightway coming to my topic. So warm welcome to all the dignitaries. My today's topic is, today I have changed little bit study of CALCARIA CARB through abnormal calcium metabolism and through pediatric bronchial asthma. This is my today's topic. How the CALCARIA CARB, the symptoms of CALCARIA CARB from source books related to abnormal calcium metabolism, symptoms of calcium metabolism, and how it is related to bronchial asthma, specifically in case of children. So now you can see that this right hand side, there is a picture of the lungs along with the bronchioles. The upper bronchiole is having asthmatic bronchiole, you can mark that, and the lower one is the normal bronchiole. In normal bronchiole, you might have marked that the diameter is very long and the area volume are more in comparison to the upper bronchiole. Here on the upper bronchiole, the diameter is very less, and accordingly the area and the we will discuss today, and this happens in case of asthma, as this is the asthmatic bronchiole. So asthma, coming to the introductory part, asthma is one of the most common chronic diseases of childhood and major health problem not only in India, but this is a global problem. A multifold increase of incidence has marked during the past decades due to increased environmental pollution, air pollution, increased industrialization, and the pollution, increased air pollution due to the increased number of the vehicles, motor vehicles, and the reduction of the plants area, the forest areas, and dietary allergens also cause the bronchial asthma, increases the incidence of bronchial asthma with children, with the adults, everyone. But the children are more susceptible to asthma. bronchial asthma has posed a serious challenge to modern system of medicine, because with the modern system of medicine, cure is very difficult. They can manage a status asthmaticus case, but cure is very difficult, which is possible only with homeopathic treatment. Coming towards the homeopathic perspective, specifically in pediatric cases, it is clearly observed in our clinics. Every clinician might have marked that the cure of chronic bronchial asthma cases, specifically in children, more numbers are with CALCARIA CARB. So why pediatric cases have affinity towards CALCARIA CARB, we will discuss today. WHO fact sheet, May 2024, there is a publication that asthma is a major non-communicable disease affecting both the children and the adults. But it is very common in children, and asthma affects estimated 262 million people in 2019, and out of that 4,55,000 deaths in 2019. So avoiding asthma triggers can also help to reduce asthma symptoms. So if we can reduce the triggering causes, then the incidence can be reduced. Otherwise, we can cure with homeopathy, but prevention, the prophylactic measures are also very important in case of bronchial asthma. And most asthma-related deaths occur in low and lower middle income countries, where underdiagnosis and under-treatment is a challenge. In PubMed, there was a publication, a study carried out in North Indian cities, taking the school adolescent children within the age of 5 to 11 years. They have taken 927 students, and the result came that the prevalence of bronchial asthma in adolescent was 13.1%. And out of them, most of the cases are episodes in the past 1 year. They have found, and the prevalence was higher among males in comparison to females. So there is a 2:1 male and female ratio, but the children are more susceptible, specifically in first and second year of life. And after 10 years of age, the proportion is the same in children, in adolescent, and in adult group. So coming to the city-wise data, this is the study, multi-center study was carried out, and the result was Bangalore has the highest number of asthma cases, followed by Calcutta, Kanpur, and New Delhi. So this is the 8th May 2013 report. So what is an asthma attack? During asthma, we find the airways is narrowed. The bronchos and bronchioles are narrowed down. The diameter reduces, the volume reduces, the area reduces. That's why the transfusion of the gases becomes very less in alveoles during that period. So what happens, coming to pathology, we find bronchospasm. Bronchospasm, the muscles around the airways constricted, and inflammation of the airways, and the mucus production is more. So in the bronchial wall, the bronchospasm occurs in bronchioles, and inflammation of the wall of the bronchioles and bronchioles, and increased mucus production, which causes the mucus plugs, and that mucus plugs which clogs the airways, that causes narrowing of the diameter. So we can find that in right side we find normal alveoli with bronchioles, and in left side we find inflammation. The red color indicates inflammation, and the green color inside the bronchioles indicates increased mucus production. And these are the three, we find three bronchioles. The transverse diameter, if we will find the longitudinal transverse, both are reduced. This is the normal airway, and the middle one is asthmatic airway, and the third one during asthmatic airway. Again, more reduced. The diameter is reduced. So predisposing factors, hereditary contributes 50 to 60% of the patients give a positive family history. Age has no limit, but within age 10, we find more number of cases specifically within the first and second year of life. Sex ratio, I told you, so 2:1, male is to female is 2:1. Respiratory infections, the children are more susceptible. Those children who are more susceptible to respiratory infections, such as viral infections, specifically due to rhinovirus, due to syncytial, respiratory syncytial virus, due to pneumococcal virus. So all these infections again contribute to as the predisposing factors for asthma. And allergens, we know, like the foods like milk, eggs, chocolates, peas, nuts, wheat, cereals, and potatoes contribute. Next, inhalants like, as I told you that the dust pollution is the major contributory factor, predisposing factor. So inhalants like pollens, dust, wool, feather, cotton seeds, animal hair, the dog and cat danders, like that. And some bacteria also trigger the infections. And pharmacological stimuli also, we find some drugs cause add towards the bronchial asthma. Occupational factors also very important, who are working in the stone factories, who are working with the stone cutters, in the cotton factories, the woolen factories, like that. They are more susceptible to asthma. And exercise, heavy exercise also contributes sometimes, and deficiency in adenyl cyclase also contributes. Climatic factors, we know the humidity, the difference of sudden difference of temperatures, the high wind difference, sudden change in barometric pressures, and high altitude. Also, asthma is better in high altitude, and low altitude contributes. Childhood asthma, poverty, and race, asthma is 2.5 times more prevalent in black children than among white children. And breastfed children are less susceptible to asthma. Passive smoking in the house by the parents, those children are more susceptible to asthma. And nocturnal asthma, we find most of the time there is a night aggravation of the asthma, and obesity also contributes for asthma. Why it is so common in children? As the time is less, so I have to go very fast today. So a well-marked number of children subsequently shown to have symptoms of obstructive airway disease early in life.
Madam, if it's we can have a second part of the same. Don't go in a hurry. We can make a second part of the same with the cases as well as some discussion. No problem.
Okay, thank you.
Don't take
Then,
it, don't go in a rush. You just take your own time.
okay, very good. Thank you. So in obstructive airway disease early in life, specifically 30% we find in young children, but 50 to 55% younger than 2 years. As we all have marked that most of the asthma cases approach to us within 1 year. Most of the cases. And a decreased amount of smooth muscle in the peripheral airways, often with adults, may result in children decreased amount of smooth muscle in peripheral airways. We find in case of children in comparison to adults. Again, those contribute less support. Okay. And mucous gland hyperplasia is the major part. Again, that is contributed that compared to the adults, we find in children that is more, and which causes increased intraluminal mucus production. And disproportionately narrow peripheral airways. As the children, the size, the body surface is very less, so also the peripheral airways, the diameter, the area is very less. So that is a disproportionately narrow peripheral airways we find up to 5 years of age, and which again contributes to the increased conductance relative to adults and render the infant and young children vulnerable to disease affecting small airways. So these are the factors which contribute to the children that they are more susceptible to bronchial asthma. Again, we find decreased static recoil of young. Being recoil means the relaxation and contraction, there is a proportion. But in case of very young children, very small children, that is the decreased static recoil of young, being predisposed to early airways closure, and which again contributes to the breathing problem and results in mismatching of verification and perfusion. Mismatching of, not verification, it is ventilation. Mismatching of ventilation and perfusion. Okay. So next is a highly compliant rib cage and a mechanically disadvantageous angle. See, this is the angle between the diaphragm and the lungs. The angle is proper in case of adults, which is very oblique, but in case of children that is mostly horizontal. So that's why the expansion of the lungs becomes very limited in case of children. So that angle again contributes for the asthmatic dyspneic attack. And decreased number of fatigue resistant skeletal muscle fibers in the diaphragm, which is poorly equipped to maintain high work output. Again, that contributes to the dyspnea or asthma. Increased susceptibility of children to viral respiratory infections. The children are very susceptible because the immunity is very less in case of children in comparison to adults. So that's why they are more susceptible to respiratory infections, might be viral, might be bacterial. So they are those infections act as a triggering factor to further excitement to contribute towards bronchial asthma. Next, coming to clinical features, we find wheezing. Wheezing is due to narrow diameter of the bronchus and bronchioles. We find wheezing, cough, shortness of breath, intercostal retractions, abdominal pain is common in children because due to diaphragm irritation, due to bronchospasm, again we find the diaphragm irritation, and that causes abdominal pain in case of children. And profuse sweat. Why profuse sweat? Because as there is a shortness of breath, to accomplish that the body tries, the respiration rate is increased during that period and the work done is more, that's why there is profuse sweat. And the low grade fevers also add to that. Fatigue may be severe fatigue because due to work done is more by the heart, lungs, everything. So a barrel-shaped chest also we find in long-run bronchial asthma, COPD cases mostly. So many reporteries coming to CALCARIA CARB, we all have found that many of the cases, most of the cases, not all, but more number of cases are cured with CALCARIA CARB. Chronic cases, I am talking about chronic cases. not the acute cases. If we will discuss that in case of bronchial asthma, we all have experienced that the drugs like arsenic, like tuberculinum, like soranum, like pulsatilla, natrum salt, Dolcamara, Pulsatilla, Silesia, so Calcaria, Phos even, phosphorus. So many more drugs we find for the bronchial asthma. They are all are very good drugs if symptoms corroborate. If the symptoms doesn't corroborate, the drug is not the right remedy for that case. But here, today my discussion is on, I will focus on CALCARIA CARB, and this is, we are studying the drug in many ways. We are studying through the pharmacological action, taking the pharmacological action. We are studying a drug through physical generals. We are studying a drug through mental generals, the keynote symptoms we are also studying. We are studying through the totality of the symptoms, the essence of the drug. So many ways we can study a drug. And today I am discussing of one way. This is not the whole thing that we can't go through the totality of the symptoms to CALCARIA CARB, not through the, it's not like that. We can go through the totality, we can go through the mental generals, we can go through the keynote, the physical generals, everything, essence. But this is a type that during my post-graduation period, my guide, my teacher told me that, Professor L.K. Nanda, sir told me that, Sumana, you go through the why CALCARIA CARB is very effective in case of children. Okay. So something is there behind. So you find out that. That's why I have gone through a type of library research. This is the, and what I found out from that the children are more consumer of milk. And milk contains highest quantity of calcium. So some calcium metabolism problem might be there with the children, which makes them a affinity which makes them susceptible for CALCARIA CARB. Might be. So we thought in this manner. Okay. So this is I'm not speaking about a research concrete outcome. I am discussing about a hypothesis. Okay, what the hypothesis we have developed. So the children might be susceptible for that. So there might be hypercalcemia, might be hypocalcemia. So calcium metabolism problem might be there. So I found out the symptoms of calcium metabolism. Again, I found out the symptoms of CALCARIA CARB from the source book like the Mater Medica Pura, like Herring's Guiding Symptoms, like Philippus Mater Medica, like Encyclopedia of Mater Medica. From all those books, I found out the symptoms of CALCARIA CARB, which are matching to the symptoms of either hypercalcemia or hypocalcemia. That means the abnormal calcium metabolism. Okay. But while dissecting the reportorial review of bronchial asthma, from many repertories, I found that in complete repertory, in respiration chapter asthmatic, 348 drugs and the CALCARIA CARB is placed in second grade. In Kent's repertory, under respiration chapter asthmatic, the 149 drugs are there and again CALCARIA CARB in second grade. In Boninguson also placed CALCARIA CARB in second grade. And in Allen's repertory, no CALCARIA CARB is not there. And Bogor's repertory, CALCARIA CARB was not there. Might be the recent advances I can say, but this is my study in 2004. So Clark, 145 drugs, CALCARIA CARB is not there. Nor again CALCARIA CARB in third grade. Special repertory, 350 drugs for CALCARIA CARB in second grade. So no repertory has placed CALCARIA CARB in first grade. Okay. But we are finding the most of the cases, more number of cases cured with calcarea carb. So some authors, Dr. Bournonville-Fortier says that calcarea carb is an important remedy like hippursul in suffocation with a tendency to the spasms of glottis. And Dr. P. Sivaraman mentions 42 drugs in his book, Asthma Cured the, I can't read, it's not visible. Okay. Again, the Faizuddin mentioned 150 remedies in the Maslow-Q2 problems, and he has also written in favor of calcarea carb. Lilienthal and Dr. P. Sankaran, Edward D. Whitman, they have also written in favor of calcarea carb. So, relation of calcium and bronchial asthma. As I told you that the main source of calcium is cow's milk and the children are the highest consumers. So, immune reaction to food such as milk and soya are relatively common in infancy and early childhood. But cow's milk some of the times behaves as the allergen to produce bronchial asthma. So in that way also we can take the food allergies may result in GI disorders, in respiratory disorders, in cutaneous complaints, colitis like symptoms, protein losing neuropathies, malabsorption syndrome. So these things can be caused due to immune reactions from food such as milk and soya protein. Allergy to cow's milk is the best studied example of food protein allergy, which are caused by immunoglobulin E. So immunoglobulin E mediated mechanism where we find these bronchial asthma symptoms are produced. So if we will find the composition of human milk and the cow's milk or bovine milk, we find calcium is 7.5 millimole in the human milk and 30 millimole in the bovine milk. Equally, another factor also contributes the presence of metabolic acidosis in the hypercalcemic conditions of acute asthma signify the severe obstruction, and obstruction in the airways predicting the presence of a hypercapnia, that is the carbon dioxide retention we find there, which leads to tachycardia, wide pressure in bronchioles, and these acidosis behavior, metabolic acidosis behaves like causes difficult breathing. Dyspnea symptoms also contributed from this, and these acidosis also leads to decrease in the free calcium level in blood. So calcium in serum undoubtedly, this ionized calcium in serum might be hypercalcemia, might be hypocalcemia due to, or otherwise we can say abnormal calcium metabolism symptoms contribute to the similar symptoms. Some of the symptoms are similar to bronchial asthma, which contributes to bronchial asthma and similar to the symptoms of calcarea carb. So common manifestations of hypercalcemia we find here, that is the in hypercalcemia we find profuse sweating. In hypercalcemia we find emaciation. In hypercalcemia we find constipation. In hypercalcemia we find the shortness of breath, the mental confusion, depression. So many things we find in case of hypercalcemia. Similarly, in hypocalcemia also we find the mental picture, we find irritability, depression, psychosis, and in physical symptoms we find osteoporosis, muscle spasm. This also, hypocalcemia also leads to bronchospasm, also contributes to bronchospasm, laryngeal spasm, papilledema, erythema, all these things, and the hair and skin manifestations, alopecia, candidiasis. So many symptoms contributed due to hypocalcemia. So here is the table. I have made the study of CALCARIA CARB through pediatric bronchial asthma and through abnormal calcium metabolism. Here in first column, I have taken the symptoms of hypercalcemia or hypocalcemia. And in second column, I have taken the symptoms of bronchial asthma. And in third column, I have taken the symptoms of CALCARIA CARB. So first we find profuse sweating in all the three columns. In all the three columns, profuse sweating contributed due to hypercalcemia. And in bronchial asthma, due to the rapid respiration, there is profuse respiration, profuse sweating. And in CALCARIA CARB also we find profuse sweating. Profuse sweating in specifically from the occipital region we find in case of CALCARIA CARB. Although in a silesia also we find in VERITA CARB also we find profuse sweating, but so more specifically from occiput we find in case of CALCARIA CARB. And weight gain also we find in case of abnormal calcium metabolism. In bronchial asthma sometimes we find obesity. And in fatty and flabby children, we find fair, fatty, flabby PF we find in case of CALCARIA CARB. Again, weight loss is also a symptom of weight gain is related to hypocalcemia and weight loss is related to hypercalcemia. And again, weight loss is related to bronchial asthma, specifically in COPD cases. We find in long chronic bronchial asthma cases, we find weight loss. And in CALCARIA CARB can be given also. Allen has written in Herring also has written in not only fatty flabby children, but also in case of emaciation, emaciated children with profuse sweating, with scrofulous diathesis, the glandular involvement, we can think of CALCARIA CARB. And again, constipation is a good symptom of hypercalcemia, and constipation is related to bronchial asthma. Again, we find, and in case of CALCARIA CARB, though CALCARIA CARB children are more diarrheic, but and feels better when constipated, but still then we find constipation in case of CALCARIA CARB. So in source books. EG fatigue also we find in the lethargy and weakness. Lethargy and weakness we find in calcium metabolism. Similarly, in bronchial asthma also we find lethargy and weakness. And in CALCARIA CARB also we find EG fatigue is the keynote discussed by Phyllis Bailey, that the EG fatigue is the keynote to CALCARIA CARB. And Clark has also written very good about this in a rhythmical manner. So sluggishness, dull and sluggishness we find in case of hypercalcemia, and in sluggishness, dull we find bronchial asthma and in CALCARIA CARB. Anorexia also in all three we find anorexia. In case of hypocalcemia we find anorexia. Next is sluggishness and dull, already discussed. Depression, melancholia we find in case of hypocalcemia, and in bronchial also asthma and in CALCARIA CARB. Irritability, despairing mood, confusion, all are found in all three categories. Coming to respiratory system, we find dry cough or loose cough, aggravation at night in all three, and in wheezing, hemoptysis, dyspnea, tightness of the chest, pain in chest, ribs, shortness of the breath, we find in all three columns under respiratory system. Coming to other systems, abdominal pain we find in all three categories. And in bronchial asthma, specifically in the children, we find abdominal pain. And headache, myalgia, polyneuropathy, myalgia, bone pain, pain in back, ribs, aggravation at night, weight loss, generalized or localized edema, we find in all three categories. Lymphadenopathy also we find generalized or localized lymphadenopathy. We find in abnormal calcium metabolism and in CALCARIA CARB. It is not written here in CALCARIA CARB symptoms. You all know lymphadenopathy is well covered as the tubercular miasmatic, stropular diathesis, tubercular miasmatic remedy. So coming to emaciation also found in both in abnormal calcium metabolism and CALCARIA CARB. Next, two columns covered these symptoms like abnormal calcium metabolism and the CALCARIA CARB symptoms like hydrocephalus, delayed ossification in calcium metabolism, and in open fontanelles we find in case of CALCARIA CARB. Tumor in head, in CALCARIA CARB we find exostosis on head. Visual disturbances we find in calcium metabolism, and in dim vision, blurred vision, we find in CALCARIA CARB. Epistaxis we find in abnormal calcium metabolism, and in CALCARIA CARB we find epistaxis. So under GI system, again we find hepatomegaly, jaundice, cholecystitis, and in CALCARIA CARB we find gallstone colic. Ascites, inguinal lymphadenopathy, crampy pain in stomach, aggravation empty stomach, vomiting, diarrhea, intestinal pains, and GI hemorrhages found in both the columns in abnormal calcium metabolism and under CALCARIA CARB. In urinary system, again we find the hematuria, burning in urethra, recurrent renal calculi, diabetes insipidus, and both are found in both the columns we find these symptoms. Under nervous system we find epilepsy, convulsion, tetany. Under skeletal system we find softening of the bone, spontaneous fracture, kyphosis. Here we find in CALCARIA CARB proved and deformed bones, gouty arthritis, osteoporosis, and here we find weak bones and crooked bones. Muscular system, we find emaciation, weakness of lower limbs, severe pain in shoulders, and periarthritic hip and knee ankle joints. And here we find rheumatoid arthritis. So again in both the categories we find the similar symptoms. So many similarities between the symptoms from source books of CALCARIA CARB and abnormal calcium metabolism. So next in skeletal system again we find emaciation, weakness of lower limbs, severe pain in shoulders, periarthritis, hip, knee, ankle, elbow, and wrist. And CALCARIA CARB is a very good drug. All of us know that for rheumatoid arthritis, for chronic inflammation of the large joints, and for gout. Coming to cardiovascular system, we find arrhythmia, hypertension, palpitation, angina. And in CALCARIA CARB again we find arrhythmia, congestion of the arteries, palpitations, severe pain in sore pain in chest, and drawing a deep breath. So these are the similarities we find in both the columns. So these are the similarities which might have contributed the children in to be susceptible for CALCARIA CARB. Of course, in adults also we may find, but in children they are more allergen to the milk. Milk may cause allergy, or they are the highest consumers of milk, so there might be hypercalcemia, might be hypocalcemia, so might be the metabolism, abnormal metabolism effect, which might have made them susceptible towards calcarea CARB. The more research is needed in this field. This is only a hypothesis. So more research study may be taken in this regard to prove this hypothesis. Next, coming to the concluding fact, chronic bronchial asthma of children have an affinity for calcarea CARB. More number of cases can be cured easily by means of calcarea CARB. I am not talking about the acute conditions. In acute conditions, we may go for arsenic, might be Hipersol, might be in rainy season, we may go for Dulcamara, we may go for arsenic, or we may go for spongia. In acute conditions, we may think of Blatta, Grindelia, we may think of many more drugs are there in this regard. So more number of cases can be cured easily by calcarea CARB depending upon the chronic totality, not the acute totality. And calcarea CARB and acute drugs depending upon the acute totality during acute state. Really, in my practice, I have seen that during acute condition, I am depending upon the modalities, specifically upon the modalities and the mental state of the patient. And modalities, under physical generals, I am taking the task, the stool, and basing upon this, I am going for the acute medicine, which is selected during that period. And when the acute condition is over, if the case is calcarea CARB, again I am coming, or in a millesimal scale, if it is available, then in infrequent doses, calcarea CARB. Or most of the time I am going to fractional doses. Calcarea CARB 200, I have made one dose in 100 ml distilled fractional, and I am giving them twice daily or thrice daily, like that. But acute medicine is highly essential during acute conditions, even if I am going for mother tinctures like Blatta, like Grindelia, whenever it is needed to manage the state, acute state. But chronically, calcarea CARB has helped me a lot. Of course, not all the cases. I have gone through natrum salt, pulsatilla, phosphorus, arsenic, tuberculinum, Puja. So many more drugs are there, but more number of children within 2-3 years of age, I find that more cases belongs to calcarea CARB. So more research is needed in this aspect. Thank you. Thank you everyone for patient hearing.
Yes, thank you. Wonderful presentation, as well as we know the exact observation, correct interpretation, and the rational explanation, as well as scientific construction, all the way together. All together, nice presentation. And it needs more and more discussions and deliberations and research works. You mentioned about this, the volume of the magnitude of the problem. Around 262 million people are affected, and that 455,000 casualties in a year. So it's a major problem, as well as you mentioned about the reasons, the expected causes behind the manifestation of this condition in children. We all know that almost all children. I think there is another factor you must not that you are not referred. That is the hereditary tendencies. As well as we may suspect the role of this BCG, the vaccination, this tubercular vaccination, is also maybe a factor in the evaluation of such cases. In very nice presentation, you continue your endeavors, all the best. So with that, Dr. Dhanesh, could you please express a lot of thanks, Dr. Sumana? Yes, please.
Yes, yes, Dr. SUMANA KUMARI PANDA, madam. It's really a very good session indeed. And you covered almost all these sessions, all part of this bronchial asthma with this calcium mechanism and the reasons which may provoke the conditions in asthma or in children, people, or whatever may be. Of course, we need case presentations also. We can do in the next session. Definitely, we are.
No, today really, Dr. Dhanesh, this part is already finished. For cases in next session, we will go for the cases.
Yes, yes, definitely. A case presentation is also very important, and since we have only very few less time, and that's only 45 minutes presentation. You done it beautifully. Congratulations for your excellent
Now,
presentation.
today I want to focus that the abnormal calcium metabolism has some relationship with the symptoms of calcaria CARB.
Okay.
Yes, definitely. Thank you, Dr. SUMANA KUMARI Panda, and those who attended the session. And once again, thanking Dr. Manoj for the wonderful, excellent moderation and keeping time in perfect.
Yes, yes.
Good night.
With that, okay. With that,
Thank you, Dr. Manoj, Dr.
program.
Dhanesh, and everyone.
Hope you that will be back again tomorrow. Till then, goodbye and.